Okay, so if your toothache suddenly disappears, that's not good news. In fact, it could mean that the nerve inside your tooth has died. And when a tooth dies, it doesn't just sit there quietly. It can become silent, toxic, and dangerous. And you might feel fine, no pain, no swelling, nothing obvious. But underneath the surface, things could be getting much worse. And a dead tooth can go unnoticed for weeks, months, or even years. And you brush, maybe you floss, and you move on with your day thinking everything is okay. But it's not. The pain that has just faded, it could mean that the infection has advanced to the next stage. And if it's left untreated, a dead tooth can become serious. It can lead to serious infections, it can spread bacteria to the adjacent bone, and even affect your overall health. And in this video, I'll show you exactly how to tell if you have a dead tooth and what to do about it before it turns into a much bigger problem. So let's break it down. Oh, and by the way, my name is Dr. Jimmy, and I'm here to help you understand dental health the easy way so you don't have to learn it the hard way in the chair. So let's start with the basics. Now, every tooth inside your mouth is more than just enamel and dentin. So deep inside, there's something known as the pulp inside the tooth, and that contains blood vessels, nerves, and connective tissue. And these help your tooth develop when you're younger, but as an adult, the pulp isn't essential for day-to-day function of your tooth. But it's still important when it comes to vitality and health. So a dead tooth, also known as a non-vital tooth in dentistry, means that the pulp or the nerve of the tooth has died. And that means there's no longer blood flow in the tooth and the nerve is no longer functioning. And that usually happens because of one of three reasons. So it could be a trauma, so a fall, a sports injury, or even grinding or clenching your teeth that can damage the blood vessels. Or it could be deep decay or a deep cavity. So a cavity that's been ignored for a long enough time will eventually reach the pulp, and that can cause the nerve to die. Or the third reason could be an infection. So sometimes from a crack or from bacteria that will invade the tooth and that can cause the nerve or the pulp to die. Now here's the part most people don't realize. So when the pulp dies, it doesn't just disappear. So the dead tissue starts to break down and that starts to create space for the bacteria to move in. And that's when the tooth starts to become not just dead, but dangerous. Okay, so how do you know if your tooth is dying or already dead? And let's look deeper into the symptoms here. So these can vary from person to person. Some people may feel intense pain and others may feel nothing at all. And let's explore the most common signs from the most obvious to the subtle. So the first sign here is discoloration, and that's the most visual sign or the most visible sign. So a healthy tooth would usually have a consistent color, but a dead tooth can turn gray, yellow, or black. And this happens because of the breakdown of the internal tissues and then the buildup of the waste products. So over time, the color darkens and no amount of whitening will fix that. But here's the catch. So not all darkened teeth are dead and not all dead teeth are dark. And this is why this sign alone isn't enough to make a diagnosis. And the second thing here is pain and then no pain. So let me explain by what I mean here. So many people experience pain at first. It could be throbbing, sensitivity to hot and cold, or even a dull ache. And then strangely enough, the pain stops. So that happens because the nerve inside the tooth has died. So there's no nerve and there's no signal to send to the brain. And this is where things can get dangerous because the pain going away may make people feel that the problem has been resolved, but in reality, it just entered a more advanced stage. And the third thing is swelling around your tooth or gums. So when bacteria escape the tip of the dead root, they start infecting the surrounding area, particularly the jawbone and the gum tissue. So you might notice a small pimple on the gum, which is what we call a sinus tract, or you might have swelling in your face, jaw, or lymph nodes. And the fourth thing here is a bad taste or smell. So if you have an unpleasant taste in your mouth that comes and goes, or if people around you start to notice bad breath that you can't get rid of, it could be a sign of pus draining from an infected tooth. And the fifth thing is sensitivity when biting down. So even if a tooth is dead, the surrounding ligament and bone can still become inflamed. So if you feel pain or tenderness when biting, tapping, or chewing, especially if it feels different compared to the rest of your teeth, it's a sign that something is off. And the sixth thing here is loosening of the tooth. So in advanced stages, the tooth might become more mobile. And as the infection spreads and eats away the surrounding jawbone or the surrounding tissue, the tooth might lose its anchor literally. And the seventh thing here, which is the most important, is if there's fatigue, fever, or feeling unwell. So this is less common but serious. So if the infection spreads, it starts to affect your immune system, making you generally feel unwell. And some people may even develop a low-grade fever or chronic fatigue. Now, you might not have all of these signs or symptoms, but you may have only one. And even if it's just one sign, discoloration or history of pain that's vanished, that should prompt a dental checkup. Okay, now this is where we really need to talk about consequences because a dead tooth that goes untreated is more than just dental inconvenience. It's a risk to your entire body. And when a tooth dies, basically the bacteria feed on the dead tissue and they multiply, they release toxins, and they try to look for a way out. And this usually means from the root down into the surrounding tissue. And one of the things it can cause is known as a periapical abscess. So that's a pus-filled pocket that forms around the tip of the root, and that can cause swelling, throbbing, or just a general feeling of being unwell. And the pain here can radiate to your ear, to your jaw, to your neck. And the other thing it can cause is bone loss. So as the infection spreads, basically it begins to destroy the surrounding tooth structure that help keep the tooth in place. And over time, that weakens your entire bite structure. Okay, so let's make this real. Say someone comes to the clinic. We'll call him George. And he said he had a bad toothache last week, but he feels fine now. And he's not worried anymore, but something just doesn't sit right. So he decides to get it checked out anyways. And we start by asking some basic questions. So when did it hurt? How long did the pain last? Does anything make it better or worse? And then we have a look. So the tooth looks a little gray, a little darker than others, and that's the first clue. So then we decide to run a few tests. So we tap the tooth lightly. That's called the percussion test, and then we put some cold on it. No reaction. And that's a little unusual. So then we decide to try an electric pulp test, and then still nothing. So then we decide to take an x-ray, and there's a dark shadow forming around the root. And basically, that's the infection. So what happened here is the nerve has died, and the body is already trying to fight it. Now here's where it matters for you, because if you were in George's shoes, you have two paths moving forward. So the first is a root canal, and that's when we clean the dead tissue inside the tooth, we disinfect the area, and we place a crown to protect it. And it's predictable, it works, and it keeps your natural tooth. But if the infection has caused too much damage, the tooth is fractured beyond repair, it has a poor prognosis, then we may need to remove it. And that's when we talk about things like implants, bridges, or dentures. So it's manageable, but it's a bigger step. And after either procedure, you'll still need a follow-up. So we'll check how the bone is healing to make sure there's no lingering infection, and will also help you keep the rest of your teeth healthy. And after either procedure, you'll still need a follow-up because we need to check how the bone is healing, make sure there's no lingering infection, and help keep the rest of your teeth healthy. So if something feels off, even if the pain has gone, don't ignore it because a dead tooth doesn't shout. Sometimes it whispers, and you have to be the one to listen.